So I chose to talk about multiple sclerosis for my medical condition that you might see in your chair that a patient might have. It affects the central nervous system, and it usually affects people in around their 20s is when the symptoms appear, but sometimes people don't have symptoms at all. It's when the nerves, the myelin sheath of your nerve is being destroyed, and it can be any part of the body, any nerve in the body. So depending on the person, you can have the symptoms. Some people might lose eyesight when they first, see a symptom. Like my brother, he lost eyesight in one eye, but it came back after the medication he went on. The guy that I had in my chair as a patient this semester, he used a walking stick because he couldn't, he lost some of his function in his legs, so he needed assistance. It just depends on the patient. You always want to treat the patient when they're in their remission stage, because if they're having all these symptoms and they're going to be uncomfortable and they're not going to want to, be in the chair for that long, and it's just not going to be a good experience for them. You always want to make sure that you're asking them, if they've had any recent issues. Sometimes they can have, a sporadic attack, and, that wouldn't be good to treat them if it had happened like a day before or something like that. They're on a lot of medications, all types of medications, and, as we know, that can cause dry mouth. So you always want to make sure that you're asking them if they're experiencing any dry mouth. And if that's the case, then you want to help them, give them ideas of what they might be able to do to help with their dry mouth, such as saliva substitutes, making sure they're drinking a lot of water throughout the day, using fluoride mouth rinses. You also want to talk to them about having meticulous oral hygiene, because their disease has, the dry mouth, and it's just affecting their overall systemic health, so it obviously is going to relate a little bit to oral health as well. So you want to talk about brushing, flossing, rinse. Something else is, as they age, depending on the person, they might lose function in, their dexterity, so you want to ask them about that and talk to them about different ways that they can, use brushes with the dog ball at the end, or, we've talked about all types of things, the rubber band holding the toothbrush like I posted on my post, just ways that will help them use the brush easier. You just want to make sure that they're comfortable in your chair. You can't have long appointments, definitely morning appointments after they've been able to get up and walk around of the day, because they might be stiff during the night from laying for so long. So you want to make sure that they're comfortable, and make sure that you're asking them if they need to get up and walk around or stretch. My patient specifically was really fidgety with his legs, and his neck would get stiff, and he didn't really like to keep his mouth open that long, so I would, let him rest for a little bit. And you obviously wouldn't have a patient for hours in your chair. You would want to schedule a bunch of different appointments, break them up with OHI and talking about how to do that, and their medical history, and then have them come back again. So, this is just one condition that we might possibly run into, and you just want to make sure that you're taking into consideration how they're feeling and what they might need for the proper care plan that you're going to make for them.